Hi everyone, welcome back. My name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom, and soon to be mom to two. So today's going to be a very special episode. Thank you so much to everyone for all the well wishes. I'm really excited. It's been kind of hard to hide this now. So all my videos have been sort of from here up. By the way, this whole room has been just sort of very quickly put together. If you've ever wondered what it's like to film an Instagram, a TikTok, or an IGTV, a YouTube, whatever, just know that behind the scenes it was a very rapidly cleaned room. Right now at my feet I have journals, articles, books. So I'm sure this is only going to get more chaotic as we add, I'm just going to put this back on the floor, more chaos and more babies to the mess, but I'm excited. And as you guys may know and put two and two together, if you've been following me, you probably were able to calculate a little far back and say that yes, I actually did have COVID-19 while I was pregnant in my first trimester. And so today I wanted to share some of my experiences being pregnant in a pandemic, but not just pregnant, also sort of going through COVID-19 and how I coped with that. So first off, I thought I'd share for any new followers some behind the scenes. I have shared a lot of our COVID-19 story in a highlight reel on my Instagram, at Dr. Amna Husain. You can follow me there and you can check it out there. It was kind of more written in real time at that time. But just to give you a behind the scenes, my husband initially tested positive. It's hard to say where the contact was from at this point. We are healthcare workers. We do come in contact with people. We do wear PPE, but I'm not here to pinpoint or trace. Nonetheless, I immediately isolated him. I was at the time about 7 weeks pregnant, and sort of isolating him meant obviously putting him completely in a different room, different bathroom, etc. But I was the only parent with hands on deck at the time. You don't realize how much you might depend on someone to watch your toddler while you go to the bathroom, or even just entertain them for 5 minutes, 10 minutes. It was just me on all the time, and that was pretty hard. That was about for 2 days. Over the course of those 2 days, I quickly arranged for myself to be tested as well. My husband tested positive on an antigen test that I had brought home from work. I was negative on the antigen test, but I was also not symptomatic at the time, so that makes sense. I went ahead and underwent a PCR test. Results came back. I was positive. So that was really overwhelming. There was a lot of anxiety, overwhelming emotions that kind of went through. I mean, in those 2 days where I was taking care of my daughter, it was definitely difficult for different reasons. It was the anxiety of trying to contact trace a lot of people, being almost like a single parent, not only just taking care of my daughter, as I mentioned, but also bringing meals up to my husband. It was somewhat relieving, I guess, in some ways to know that I was positive, that I could unisolate my husband and we could both kind of work together now to take care of our young daughter. In other ways, it was incredibly difficult and stressful. I think as a healthcare worker, we've been through, at this point it was November, so I'm saying about 9-10 months of this very high stress environment when you're going to work, and now here you are, you're infected with a virus that you've been working really hard to not get, right? We did all the right things, masks, distancing. Really, we've stayed at home almost every weekend if we can. So it was a lot to sort of process for me. I think the other part of it is being a physician, there is a difficult aspect to too much knowledge, and that's sort of what I felt, that sometimes when you know too much, it can be really scary and you have to reel back your mind from the worst case scenario. Of course, being a physician, I knew one of the risks could also be potentially miscarriage as well. As a pediatrician, OB and pediatrics share quite a bit of overlap, so sometimes we'll have to know what the prenatal risk factors are for mom and how they could affect baby, and then the OBs vice versa. They have to think about mom's risk factors and how they could affect a newborn. So I did know that there were risks, obviously contracting this virus and risk contracting it in the first trimester. Again, if you followed me for some time, you've known that I did a number of years ago have a miscarriage, and I think that anxiety and fear really never quite goes away. At least it never really did for me. And so that was, again, something really real in the back of my mind. So what did I do? Honestly, guys, I do try to practice what I preach. So when I tell you all to please go to your physician for your own personal medical advice, that's exactly what I did. So I actually had an OB appointment the next day after I had gotten the positive test. So I called to cancel that appointment, let them know I was COVID positive, and let them know that I would like to speak to my physician to ask them questions, right? I did not want to be my own doctor. He and I were able to talk about what symptoms I should look out for, what the red flags would be, and it was just kind of nice to be able to touch base and sort of have a plan moving forward. In terms of what symptoms my husband and I had, again, you'll probably be able to learn more in my Instagram highlight reel on our COVID-19 story, but both my husband and I had about 2 to 4 days of very low-grade fevers, no true fevers, but elevated temperatures, muscle aches, cough, fatigue, and loss of sense of smell and taste. My daughter also became ill, and luckily I was a pediatrician, so I was able to manage her, and she overall did okay. She had a fever and a runny nose, but of course I was able to monitor her at home for red flag symptoms. And again, we're very, very fortunate that we overall, all three of us, did very well. So in addition to my OB, my own physician, where did I go for medical advice? Really, guys, I didn't Google. I am lucky that I have access to good medical journals and I can find resources. And again, just like I mentioned, pediatrics and OB share a lot of overlap. So I've been actually watching the course of how pregnant women do with this disease, and I knew overall what their course could be, just simply as a product of me being a pediatrician taking care of newborns. So the sort of second and third places I turned after my own personal physician was talking to friends of mine who were OBGYNs and friends of mine who were pediatricians who had taken care of patients who had been COVID-19 positive in their first trimester. So as you can imagine, this was November, and if you count back far enough, really it was women who were pregnant in their first trimester in March and April who were possibly delivering now, and we were finding out if there were any repercussions to being positive in your first trimester to baby. So it was pretty new, but again, reassuring data that overall the women do well. But there was no studies or papers published at that time that I could take a look at. So I was kind of just going off of what my doctor told me, what I sort of knew from my own medical knowledge, and what my maybe pediatric colleagues in New York had seen from women who had delivered and were positive in their first trimester. Now, lastly, I did turn to a few doctors on social media, a few OBGYNs, reputably Dr. Marta Perez, and she has a video, and I'm going to link it right here, but it's on a Q&A in terms of COVID-19 positive in the first trimester. I think Marta would agree with me that at that time, most of her answers were, we don't know, which is 100% understandable. We just didn't know. And it was probably just nice for me to know that I could go to somebody who was a reputable source. And so it was kind of nice to just get another resource there. But for me, that's sort of the hierarchy, and I usually tell you all as well that go to your personal doctor, then later definitely turn to social media for guidance, but we can't provide personal medical advice. And that's always the way I've felt, even in my own situation. So after my 2-week quarantine period, I did get to sort of catch up on my prenatal care and went in and also got an additional ultrasound so that we could just check how baby was doing, and everything seemed to be okay. Again, this was at about 8 or 9 weeks into the pregnancy, so it was reassuring. It was nice for me to be able to sort of talk about my symptoms with my OBGYN and talk about our plan moving forward. Let's talk about the vaccine, because again, if you've sort of followed me, you've seen that yes, I did choose to get vaccinated in pregnancy, and I want to talk about why I made that decision. So first of all, when can you get the vaccine? Really, you can absolutely get the vaccine if you're a healthcare worker, just as long as you're not having an active infection or sick with any other virus, cold, flu, any other kind of symptoms at the moment. So if you are having an active infection or are sick, it's better to defer the vaccine. You 100% should do that. And those are not my rules or my guidelines. It's actually the CDC's guide. Otherwise, what if you have had the infection and you get your chance to get the vaccine? When do you get it? So some medical facilities may be actually holding off until the full 90-day period after someone's had an infection due to the theoretical window we expect antibodies to last. I have seen some antibodies after active infection last longer than that, and some last shorter than that. Obviously, we'd like to vaccinate those first who don't have immunity. But if you get the opportunity and there are enough shots, then yes, 100%, you should go through with it and get the vaccine if you feel comfortable. And that's where I was. So I felt comfortable with my vaccine, and I was given an opportunity within my 90-day window where there were enough shots. And again, I was in phase 1A, so I was able to get my vaccine. How did I make the decision to get the vaccine? Well, as a physician and as particularly a pediatrician, I talk about vaccines day in and day out. I have a pretty good understanding of our biology and what vaccines do to our body. I did read the Pfizer and Moderna briefs myself, broke them down for a lot of you on social media, on my Instagram, and there were no reports of women suffering infertility. In fact, many women actually unexpectedly conceived in between their doses. So for me, that was reassuring. In general, no, we do not have pregnant women or young children in these trials. So no, this vaccine hasn't necessarily been tested on pregnant women and young children, but that's actually the way we typically proceed with science. Usually pregnant women and young children are considered vulnerable populations, and we usually wait to test in them after the initial trials that we do in the general population, including non-pregnant women. I do have a video that I'll link right here that talks about breastfeeding in the COVID-19 vaccine, and in that video I recommend making an informed decision with your provider, and that is exactly what I did here in this situation, being pregnant and deciding on getting the COVID-19 vaccine. So in terms of resources, I looked at the statement put out by the Society of Maternal Fetal Medicine and the statement put out by the American College of Obstetrics and Gynecology. I'll link both of those below in the show notes. They were very clear for me. They were very to the point. They made sense. Really, there was this very highly likelihood of plausible benefits, and then a plausible risk, of course, because this hasn't been tested in pregnant patients. Sort of understanding how vaccines work and knowing the risks, those are the things I looked at going forward. Let's talk about the vaccine for a second. This is an mRNA vaccine. It's the first of its kind, but you have to kind of understand how mRNA works. It works almost like a Snapchat. So you guys remember Snapchat? It's there for a second. It shows a blueprint and then it's gone. Your body creates that protein that the mRNA was the blueprint for, and then we as a human host create antibodies. Our immune system becomes activated and revved up and creates antibodies against that spike protein the virus SARS-CoV-2 carries. There's zero data to suggest that it attacks the placenta or the fetus. This is sort of a urban myth that has become perpetuated. So knowing that, I made a decision and talked with my husband. We almost didn't talk because we were sort of silently on the same page, but I did. I reached out to him and sort of asked him point blank, like, how would you feel about me getting this vaccine? And he supported me either way. In fact, the scariest aspect for us was getting COVID-19 while being pregnant, and that already happened. And so the vaccine seemed like a much safer way to potentially get longer lasting immunity. So again, along with the resources by Society of Maternal Fetal Medicine, ACOG statement, and the understanding science, vaccines, biology of the human body, discussion with my husband, and then going forward, talking to my OBGYN, I was able to make a decision. I did literally tell my OBGYN that I'm scheduled for the vaccine tomorrow, and I feel very comfortable getting it. Is there any reason that you think I should not? And she agreed with me. She said that absolutely we stand by ACOG statement and I think you should get the vaccine. So on December 23rd, I got the first dose. I was at about 12 weeks at that time, and I got my second dose when I was 16 weeks. So overall, I did pretty well with the vaccine. I'll tell you, my sort of side effects afterward were completely expected. They were muscle aches, a sore arm, but that was really about it. Nothing really compared to the muscle aches I had when I had COVID-19. The second vaccine, I maybe had about the same symptoms, just a little bit more intense. So the muscle aches were a little bit longer, but they were definitely resolved by 24 hours. The sore arm hurt a little bit more into my chest, but nothing that, a heating pad couldn't fix. I didn't take any Motrin or NSAIDs or ibuprofen because I was pregnant at the time. Now, I weighed the possible risks and possible benefits for myself getting this vaccine. So here I was pregnant, not necessarily immunocompromised, but a state of lowered immunity. So I'm not really the same as, somebody who may have AIDS or be on chemotherapy, but a state of lowered immunity. I had COVID once and did okay overall, although I was very scared, and I did check my pulse ox a few times and check my temps throughout the day. I am a healthcare worker, and that puts me at a higher risk I'm also in, pretty high risk environments too, close to people's faces, even though I'm wearing PPE. And then we have COVID variants going around as well. So there's no saying that I couldn't possibly contract the infection again. I was looking to protect myself as much as possible going forward in this pregnancy, and as a healthcare worker and as a mother, in addition to continuing masks and distancing like we really already had been doing in our household. So now let's talk about the science, the data that we have now. So fast forward from November and we are in February. And let's talk about what we know so far about moms who have been exposed to COVID-19, had COVID-19, and what we know about their newborns. Well, in general, we actually know that they do carry on antibodies just like we expected. So the particular type of antibody is called immunoglobulin gamma, or IgG as you might hear us referring to it as. So we actually were able to detect those antibodies in cord blood of newborns who were delivered after moms had already had an infection. So I don't know about you, but as a mom who's had the infection and 100% was eaten up by mom guilt of, oh my gosh, what did I do? How could I have this infection? Even though I knew it wasn't my fault. It just hits us like a ton of bricks when we least expect it to. That felt so good for me to hear that, okay, we do absolutely have evidence, just like we have been theoretically thinking, that newborns do have passive immunity, or immunity produced by another individual that is carried on to the other individual from mom if she were to acquire the infection. The other data that we have is actually a case report that's not yet peer reviewed, at least as of now, February 8th, 2021, on a mother who actually was vaccinated, a healthcare worker, I believe, who was vaccinated, and her newborn also has evidence of antibodies in their cord blood. So for me, that was very reassuring, and it made me feel good. It made me feel good about my decision. Now, I do know many people who are even close to me who work in the healthcare field and chose not to get vaccinated. That is their decision. This was my informed decision, and I just want to tell you guys about how I came to that decision. As I open up more about this pregnancy, I'm going to be sharing a little bit more about my medical history, which again is a little personal, but I just want you guys to know about this now, because lest it come up later and somebody think that it's due to the vaccine. So in my last pregnancy, I did have gestational hypothyroidism, which is not uncommon. To meet the increased metabolic needs in a pregnancy, there is a change in thyroid physiology, which reflects in the altered thyroid tests. Not all women do have altered thyroid physiology, some women do. So for me, for example, in my last pregnancy, where my daughter is now 3, I was on Synthroid during the pregnancy, and I did get my thyroid tested, and then after delivery I did not have to take it any longer. Just again, one of those things that happens during pregnancy. Again, it happened during this pregnancy as well. It was, in my opinion, in my knowledge, never at all related to the COVID-19 vaccine. This again happened to me in my first pregnancy, so I don't believe it. All of this was related to the vaccine. Second, in my first pregnancy, I actually also developed gestational diabetes. The placenta, I know. Nonetheless, I did get tested again at 16 weeks. It was actually sort of the same week that I got my second Moderna vaccine. I got tested earlier this time just because I was at a higher risk for potentially getting gestational diabetes again. And I did okay on my 1-hour glucola test, actually. I passed it. So we'll see again at the 28-week mark, but I want you guys to know that whether it's positive, negative, I have to take a 3-hour test or not, this is not at all related to my COVID-19 vaccine. There's a medical profile that existed before this vaccine even existed in my bloodstream, and we will see sort of how history either repeats itself or doesn't repeat itself for subsequent pregnancy. Lastly, I do want to mention to you all that I am enrolled in a COVID-19 vaccine study for pregnant women through the University of Washington. I have completed a number of surveys for them after getting vaccine 1, after getting vaccine dose 2, a month after I've received the vaccine, in which I've been able to write my symptoms after getting the vaccine, even just write my medical profile and write that I did have COVID-19 and what my symptoms were when I had the active infection, questions about how long my symptoms lasted, questions about any adverse effects I had with the vaccine, even if I would recommend the vaccine. So I am enrolled in this study right now, and for me it's really nice to be able to contribute back to science in a way. So I'll let you know how that goes. Now, speaking of, since I mentioned that the study does ask me, do I recommend the shot? Listen guys, I'm not here to tell you that you need to get this shot and I'm making sure that you do. That's not my job here. I just wanted to provide a perspective for you. Like with the breastfeeding and COVID-19 vaccine video I made, I'm here to provide data. I recommend it for myself. Feel comfortable with it. I think if a healthcare worker feels comfortable getting it, she should absolutely talk to her personal physician, weigh her risks and benefits in the context of her situation, and then if she wants to go ahead and go through with it, she should not feel necessarily guilted by other members of society about making that decision for her and her child. If you are expecting or thinking of expanding your family, I hope that this video was helpful. I encourage you to look at the resources that I have listed in the show notes below. I encourage you to talk to your doctor, weigh your risks and benefits in the context of your own personal situation. And thank you guys so much for listening along. I hope me sharing my experiences has been enlightening for you. If you'd like to hear more about sort of my pregnancy journey along the way, in addition to many other things, pediatrics, parenting, please feel free to subscribe below.